Hello, 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 friends. We are back to our T4 topics, and we are going to be talking about the Coalition of Skin Diseases, so CSD on the Hill. And I just am going to escape here for a second and make sure that I see everybody and that I'm not muted. Okay, we are rocking and rolling. All right, so let's just go to the screen share here so y'all can see my screen. All right, share. Sharing is caring. All right, and we should be popping up now. Perfect. All right, we are in screen share. So we are going to start from the beginning here. All right. So again, thanks for tuning in back to another T4. And this is a really special topic for me because I really think that advocacy is so important for us as dermatologists, for our patients, for ourselves. Because if we don't speak up, things are going to happen without us having input. So again, Coalition of Skin Diseases, we went to Capitol Hill and we were able to advocate for those with skin diseases. So I'm just going to share a little bit about that. And I do want to say I'm very excited about the Coalition of Skin Diseases. It is basically near and dear to my heart because it provides support and advocacy for patients outside of the clinical setting. And again, advocacy is so important and it's a big part of the coalition. So what is advocacy? It's any action that speaks in favor of, recommends, argues for, supports, defends, or pleads on behalf of others. And how that really comes into practice is it seeks to ensure that all people in society are able to have their voices heard on issues that are important to them, to protect and promote their rights, and to have their views and wishes genuinely considered when decisions are being made. And again, we have such an important voice as dermatologists for our patients, so that their issues are considered and our issues as providers of care for patients with skin disease are heard as well. Because if you don't have a seat at the table, you're probably on the menu. And I know this didn't refer to people with skin conditions, but it really does. If we are not there advocating for our patients aren't there advocating. Skin disease, unfortunately, because it does carry such social stigma, a lot of people I feel hide in the closets and again don't come out because number one, previously, we didn't have great treatments for a lot of skin conditions and patients got frustrated and didn't want to come in to see us. But now that the treatment regimens are getting better, there's more therapies available that really make a difference in some of these rare conditions that didn't have treatments before. I think people are kind of coming out of the woodwork to get care. And we need to put things in place so that really these patients' needs are seen on a big scale. So again, these are some pictures from Capitol Hill. This over here is the group in front of the Capitol Hill, and this is right here. I don't know if you can see my pointer, but this is Kelly. She is the executive director. She's amazing. She's had her own skin issues, so she really has a story to share that fuels her passion, which is the best kind of passion to have, because if you've lived it, you understand it. And then these are some of the patient advocates from other organizations. This was our Texas team. And then our Texas team again at one of the lawmakers' offices where we went to meet and advocate. So the Coalition of Skin Diseases, again, it's very near and dear to my heart because it really shines a light for people with skin conditions, and the efforts of the CSD aim to ensure that all Americans living with dermatologic diseases and skin trauma receive the care they need to live happy and productive lives. And they do advocate on behalf of the Americans living with skin disease. And I am actually on their board of directors because I believe in the reason they exist and their mission so greatly. So the Coalition of Skin Diseases, it used to be more under the umbrella of the American Academy of Dermatology. And through some restructuring. We're kind of coming out of our infancy and into our own adolescence, still with great support from the Academy of Dermatology, which is very much appreciated. But our perspective as patient organizations and people that are living with skin conditions is a little bit different than the Academy. And again, there's a lot of partnerships and overlap where we can support one another. But the main aim of Coalition is to really shine a light on the patients, the 84 million Americans living with skin disease, which is kind of crazy. There's very common conditions that the CSD supports: National Eczema Association, National Psoriasis Foundation. Those are the big guys. But then there's also all the rare ones: the pemphigoid, the pemphigus, the xeroderma pigmentosa, Gorlins, Pachyonychia congenita, so many other great organizations. Certainly multiple organizations on hidradenitis suppurativa are supported, vitiligo. So it's a great organization to be a part of. It represents real people. And here are some of those real people that I was on the Hill with. So all of these sweet friends have either a family member or themselves that have a significant skin condition that has impacted them. And they were there to advocate for all of the people that couldn't be there advocating. And this is me with one of my very sweet patients and his mama. So this is Turner. He has lived with psoriasis and he is an amazing guy. And really, he did a great job advocating on the Hill. I was so proud of him. So some more friends, more real people out there. So this sweet mama has a sweet baby girl that was born with Harlequin. This sweet woman here is the founder of ITSAN, which is for the topical steroid the withdrawal syndrome that happens with topical steroid withdrawal. Again, Kelly, the executive director. And then this is sweet friend Brinley. She is also on the board with me and her daughter, and they live with HS, both of them. So again, very real people. Some of my friends with XP, some of my sweet friends here. This sweet girl is an amazing teen advocate with National Alopecia Areata Foundation. Sweet friends. Oh, Alicia, she is so amazing, Alicia. And she started an organization called So Rare They Stare, which I love that. Another sweet friend, Masse World, she has a congenital nevus. She started an organization to support those with albinism and also vitiligo. And then this was one of her patient advocates that she brought. And he has been in movies, so you may recognize him, but it was great. He spoke at our congressional briefing, and just so fun to meet these real people with real problems. And we know this, and again, I feel like you probably hear this a lot from me about the burden and impact of skin disease. It's not just the life impact, the quality of life. It also affects the length of life for some people. The stigma is huge. And then too, the financial burden for our patients. And again, it's very easy for us as providers to write a prescription, but if that prescription is never going to be covered or able to be afforded, then our patients aren't going to get the care that they need and they deserve and that we want for them. It can cost the healthcare system $75 billion in medical, preventative, and prescription and non-prescription drug costs. So that is mind-blowing. $75 billion is what it costs annually for people with skin conditions in the US medical system. And then direct loss opportunity cost is 11 billion. So families that the parents can't work because of their child's skin condition, or an adult that has a skin condition and can no longer work and have those opportunities in their lives. And then rare diseases. So again, the coalition represents very common skin conditions. It represents very rare skin conditions. A lot of those are genetic and have a smaller number of patients that are affected. But then it also represents the rarely talked about, kind of like hidradenitis suppurativa. Those patients have lived kind of in the shadows. So again, Rare diseases, there are more than 800 diseases affecting 6.8 million patients worldwide. And this is abysmal that there's only been 100 drugs that have been developed for treating rare skin diseases in the past 40 years. And again, I see that landscape changing, and I'm so thankful for these drug companies now that are taking on these more rare diseases and trying to find treatments that really do have an impact on these patients' lives. But again, we just need more rapid pace for those to be developed because, again, this isn't acceptable where we're at currently. And then again, more impact. Patients are frustrated by the minimization of their conditions. Again, they're not validated. And I know we've talked about that before, which makes it even harder to live with the condition. And then the physical and psychosocial, it has impacts, as we all know, and you guys are experts on that because you watch T4. But again, and you guys know this from being on the front lines and taking care of patients in clinic, patients can't access or afford their treatments sometimes. And the poor mental health outcomes are largely neglected. And again, I do think that that dialogue is changing, again, very slowly, but I'd love to see the pace of that increase. And again, all of you that are T4 graduates and have been involved with this program, you really, I know, are going to make a difference in this area. And then again, just feeling all alone is something that Made a Masterpiece is really helping, and the Coalition of Skin Diseases. So again, we're growing in strength and in visibility as well. So our patients with dermatologic diseases, we know that they need legislation that helps to facilitate their care. And so when we went to Capitol Hill, we had funding recommendations, each of us as constituents and different, from across the country. We were well represented, and we had teams that went in and met with Congress people and our legislators. And the first ask was that the National Institutes of Health increase their funding to $51.3 billion, and then provide a proportional increase to NIAMS, which is the National Institute of Arthritis and Musculoskeletal and Skin Diseases. So that is the branch of the NIH, NIAMS, that supports skin disease research. And we luckily at our congressional briefing was able to hear from the director of NIAMS, and she's an amazing woman and really has the best interest of patients with skin disease in mind as far as directing research. So it was great to hear her perspective. And I can say that my daughter did work at the NIH, and there's so much great research happening there. And I know we know that, but to be able to see that firsthand is pretty amazing. So again, we need more funding for the NIH. And then this is an interesting part. So the CDC, a lot of, bigger conditions, that affect more people, like heart disease, they have a wide understanding. People know that heart disease is bad and cancer is bad and that needs support. But the Chronic Disease Education and Awareness Program at the CDC helps to kind of raise awareness and public health concerns in regards to rare diseases that are collaborative, that put us together. Like, again, with skin disease, there's very few people that have Pachyonychia congenita, but when we put everybody together, there's more than 84 million people with skin disease out there. So it just that collective stance. So we definitely want to increase the CDC's funding for this program that raises awareness about conditions that may not otherwise have a voice. Also, safe steps. You guys know this. It's so frustrating as a care provider with the Safe Steps Act. So basically, all the hoops that we have to jump through to get our patients our medicine. So we know that with Dupixent, you have to have failed, so many different things. Like they want people to have failed a topical steroid and, topical calcineurin inhibitors, and also potentially even have been on cyclosporin or methotrexate. And those are not even FDA approved for the conditions we're treating. So again, there are people that are making decisions for our patients that don't have the best interest of our patients, and puts them through these steps that are not only frustrating for us as care providers, because we need to expose patients to a certain amount of things that we know are just not going to work. And it also puts a burden on our practices because we need to hire more people to be able to do these prior authorizations and jump through the Safe Steps Act requirements. So again, we are asking them to sponsor this, co-sponsor and advocate for the Safe Steps Act, which will then make it more clear and transparent and hopefully prevent the need for step therapy that's not going to be helpful for our patients. And then again, the Helps Copay Act. So a lot of patients, and I'm so thankful, and I know that you are too, for so many of these companies that have these more expensive medications that are coming out, the biologics, that are hard for patients to access if they don't have these copay assistance programs. So again, those are funded by the organizations, the drug companies, pharma, that then offset the costs so patients can get the treatments that they need. And they're very helpful, but those payments are basically, these companies are double dipping, where they're not reducing the patient's burden. So if they run out of that copay assistance through the pharma company that has their drug, they then can't continue it. And because even though they've gotten that drug and they've been paid, their copay assistance, it doesn't kick in, so they still have their huge deductible to meet, which again then puts them back into not being able to have therapy. So again, we want our legislators to co-sponsor and work to advance the Help Copays Act, which it has a number there for you. And then also the Pharmacy Benefits Transparency Act. So crazy enough, there are 3 companies that control about 85% of the market of our drugs. And they're being able to price gouge our patients and really set unfair pricing schemes out there. So we want our legislators to co-sponsor S127, which is a Pharmacy Benefit Manager Transparency Act, to make it more transparent about pricing and pharmacy fees for our patients. And then also, this is another big one, the Protects Act, which really helps patients with rare diseases to get equal and comparable treatments. And so a lot of times, because drugs aren't studied in rare populations, they can't have FDA approval, and then the drug companies are not able to have enough patients to actually get FDA approval. So these patients are being denied treatment just by their insurance providers because they just say, oh, it's not FDA approved for this condition, even though it may be helpful. And there's even data in the literature that may show it's helpful. They can't have access just for a logistical purpose through their insurance. So again, this would help reverse that. So patients with rare diseases could access these treatments that may be helpful in their care, even if they're not FDA approved. So again, it is very important for us to speak up on behalf of our patients. So we do have very unique perspectives, and really our stories are what make a difference on Capitol Hill. Yes, we are not the hugest, biggest lobby out there, but with the support of the American Academy of Dermatology Association Coalition, we are increasing our voice. And when we come together, that makes our voice even stronger and more powerful. So again, I think it's really an important opportunity for us as dermatologists to share our unique perspective. And it's really fun to connect with these patient disease organizations and advocacy groups so that our legislators can hear our voice. So that is a big ask today, is for you, as a dermatologist, as a future dermatologist, as a dermatology advanced practitioner, that is out there kind of really slugging away to get your patients the care that they need. One thing that we can do in a united front is to reach out to our elected officials. So anybody that hears this talk, I would encourage you, wherever you are in the country, to go to this website and look up who your elected officials are. It will show you your federal elected officials, so your U.S. Congress people, and also your U.S. representatives on the federal level. And then it also, you just have to pop open this little plus tab here, and it will show you your state officials and then also your local officials. And again, the more of us that reach out and really ask for support of these different bills that are going through for support and advocacy in regards to our patients' needs, the more likely we are to not only benefit our patients, but also to benefit us, because we'll be able to practice medicine the way it should be practiced. So again, anybody that's hearing my voice, please take the time to do this. Reach out to your elected officials, and again, go back through these slides, put together just the bill names of what we're trying to advocate for. And I know that, through the coalition, there's other ways we can support. And certainly if you have any interest in any of these conditions, I know all of the organizations that are represented by the Coalition of Skin Conditions or Skin Diseases would love to have, more support from dermatologists, more interest in their conditions. So there are rich opportunities for you as future physicians, current dermatology residents and students. They would love to engage with you and have you as part of their team, because again, we are better together. And if you have an interest in any of these organizations, I know most of them and their leaders, I'd be happy to put you in touch. You can always reach out to me through my email at Sages and through the PEDIATRIC site through Sages, just because we do want to put you in touch with things that will increase your passion for the job as a dermatologist. And again, we're better together. So again, reach out, please. And if you need any help doing so, reach out to me and I can help you. There's also ways through the American Academy of Dermatology. This is on their website of ways to take action, advocacy priorities. Currently, the AAD is really pushing for Medicare reimbursement for dermatologic disease, as far as treatments and surgical reimbursement. So that is the AAD's top priority. Also, they keep active on the pending legislation, and I know they'd be happy to have you supporting that. Engaging in your state society is also important to highlight our specialty. So again, lots of ways to engage with the AAD. And then also just a little plug and a big shout out to Sages. Again, that's one of my hats that I wear, is my Sages hat. I wear my coalition hat. But right now I'm going to put on my Made a Masterpiece hat and just thank Sages for their just great support of Made a Masterpiece. Over the years, have donated close to $100,000 to support the social, emotional, and spiritual needs of children with skin disease. And they are doing, once again, Masterpiece May, where we are receiving $1 per biopsy from the Houston market and Houston practices. So if you are in practice, please send all your biopsies, especially in the month of May, but forever and ever, because of the great service you get to Sages. Because they are specifically donating $1 to our organization during Masterpiece May. So thank you to Sages. And then if you do want to support Made a Masterpiece as well as a future dermatologist, current dermatologist, or student, there's all kinds of ways to support us with your time and your talent, but also your treasures. So we do have a Masterpiece May fund drive right now to support our Positive Perspectives program, which helps patients see, these kids see their skin condition as a way to stand out as a positive instead of a negative. So again, we would love your support in any way for that. But again, the biggest thing that I want to advocate for with this lecture is advocating for your patients, reaching out to your legislators, and really taking an active role in that so that you can feel like you're making a difference. Because some days I know when we sit down and have to do all those prior authorizations and the step therapy things, it feels like we're not making a difference, but we are. Our patients appreciate us and they are thankful for us. And again, we are changing lives as dermatologists. So keep up the great work, y'all. Y'all were made a masterpiece. And again, if you guys need any support in reaching out to your legislators, please, please, please get in touch with me. Because I would really like to help make that a priority. opportunity for you. So tonight is a short little session, but we are going to be coming back in June. We're going to have some great sessions that are going to be pre-recorded, and I know that boards are coming up, the core exams. So we are going to be doing a little bit more board prep and board pearls with some of our great pediatric dermatologists during the month of June. We're also going to be launching patient perspectives. So with each of these coalition groups, each condition, we're going to be bringing on a physician, a dermatologist that has expertise in those conditions, a patient that has that, and an advocacy person through the organization to really help you understand the patient's perspective. Because as a dermatologist, the more we can truly understand our patients, the better care we can provide, and feel more fulfilled all around. So that is going to be happening. And then in July, I'll be at the Society of Pediatric Dermatology meeting in Toronto with my wonderful and esteemed colleagues in pediatric dermatology. And we are going to be launching after that a bunch of great, really informative, kind of clinical lectures in the T4 series, in addition to the patient perspective series. So I'm so excited for the future. And I hope you guys all have a great, great summer. I know that there's going to be new residents coming in soon in July. So congratulations to the residents that are wrapping up here soon and looking to go out into the wide, wide world. And also, to the incoming residents, we're excited to welcome you around the country, welcome you into the SAGES teaching platform with the DermPath happy hours. And I am going to be working with Dr. Davis, hopefully sometime very soon, to get another PD Derm CPC going together with him. So again, be on the lookout. We're so thankful you're part of the T4 community. And we will see you again in a couple weeks. All right, y'all. Bye.